They handed the new nurse the mute Army Ranger because they said he was impossible. Welcome to Hidden Badges Stories. If you've ever been told you were too quiet to matter, too new to be trusted, too soft to survive a hard room, this one is for you. Hit the like button if you're with me tonight, subscribe so you don't miss what comes next, and drop a comment letting me know where in the world you're listening from. I want to know how far these voices carry. Now let's go back to the morning Tatum Rowe walked into room 7. The Glenridge Veterans Medical Center sat on the flat edge of a mid-sized Georgia city, where summer lasted 9 months and the parking lot smelled like pine sap and old cigarettes. It was the kind of building that looked recently painted from the outside and never quite clean on the inside. The carpets in the family waiting area were a shade of green that had stopped being fashionable in 1994. The coffee machine in the staff lounge dispensed something that was neither coffee nor hot. Tatum Rowe had been working the orthopedic and neurology rehabilitation floor for 11 days. 11 days of being handed the supply closet key and told to refill the linen cart. 11 days of having her questions answered with long sighs. 11 days of the charge nurse, Rhonda Steck, looking through her like she was a smudge on a window instead of a person standing right there. Tatum wore her scrubs, bright cerulean blue, always pressed, and kept her dark hair in a braid so tight it never moved. She was 33 and looked, people sometimes said, like she couldn't possibly be old enough to be a nurse. She had learned to accept that assessment. Looking younger than she was had once been an operational asset. Here, it just meant doctors talked over her head at the medication cart. On the morning of her 12th day, Rhonda set a patient chart on the counter in front of Tatum and didn't say anything. Just watched, with her head tilted and her smile already loaded. Tatum looked at the tab, room 7. "He's all yours," Rhonda said. 2 nurses near the window looked up from their phones. Kyle Pender, a second-year nursing resident, leaned against the counter with his coffee and his chin lifted in the particular way people hold their chins when they are expecting a show. "He's been here 22 days, Rhonda continued. "He won't speak, won't write, won't acknowledge staff. He has thrown a meal tray twice. Imaging won't cooperate because he won't hold still long enough. Dr. Sire has him charted as non-communicative with behavioral complications secondary to TBI. "What's his primary diagnosis?" Tatum asked. "Delective mutism, post-traumatic, left temporal lobe injury from a vehicle blast. He can hear you just fine, he simply chooses not to respond." "Has anyone asked him why?" Rhonda stared at her. Kyle made a sound that was not quite a laugh. "Room 7, Rhonda said again. "Vitals, pain assessment, range of motion evaluation if he cooperates. Don't expect him to cooperate." Tatum picked up the chart. "Sergeant First Class Eli Brand, 39 years old, 75th Ranger Regiment, retired. 7 deployments, traumatic brain injury sustained during a vehicle-borne IED detonation, 26 months prior, left temporal fracture, surgically repaired, post-traumatic stress, moderate to severe, selective mutism, onset post-injury, right knee reconstruction, 6 weeks post-op, admitted for rehabilitation." 3 red flags printed in the chart. Non-compliant, aggressive, refuses all cooperative interaction. Tatum had seen those flags before. They usually meant someone had stopped trying to speak the right language. She walked to room 7. Behind her, she heard the small sound of a phone camera shutter. The hallway of the neuro-rehab ward smelled like antiseptic and something underneath it. Something older, like the kind of fatigue that settles into walls over years of people not getting better fast enough. Veterans sat outside their rooms in chairs along the corridor. Some looked at the floor. Some watched the door to the stairwell the way people watch exits when a room has stopped feeling safe. Tatum understood that impulse well. She stopped outside room 7 and looked through the narrow window. Eli Brand sat upright in the far corner of the bed with his back to the wall, not the headboard, the actual wall. His knees were elevated, the surgical one wrapped and propped on a pillow he had arranged himself. He was broad through the chest even in a hospital gown. His jaw was something cut rather than grown. His hair had gone past regulation. His eyes, pale green, perfectly still, moved from the door to the window, to the oxygen port, to the sharps container mounted near the sink. He was not being difficult. He was clearing a room the way men clear rooms when the room has not yet proven itself safe. 2 rehabilitation aides stood near the foot of the bed, looking relieved to see anyone appear in the doorway. A tablet propped on the bedside tray read in large font, "Patient cannot speak, type messages here." The screen was cracked from corner to corner. The battery icon read 4%. Tatum knocked twice on the doorframe, low and deliberate. Eli's eyes moved to her hands, not her face. She entered slowly, palms visible, body angled 15 degrees away from the door so the exit remained open behind her. "You 2 can go," she told the aides. "You sure?" the older one said. "Yes." They left faster than she expected. Tatum kept the door open and moved directly to the whiteboard on the wall across from the bed. She wrote in clean block letters with a blue marker. "My name is Tatum. I am your nurse. I will not touch you without asking first." Eli read it. He didn't move. She wrote a second line below the first. "The table is dead. I brought paper." She pulled a yellow legal pad from under her arm and set it on the tray table between them. She uncapped a second marker and placed it beside the pad. Eli looked at the pad, then at her. She wrote, "You don't have to write anything. Blink once for yes, twice for no." He held her gaze for a long moment, the kind of moment that contains a decision. Then he blinked once. "Pain," she said. "Are you in pain right now?" One blink. "Where?" She held up the pain diagram from his chart folder. "Point." He lifted one finger, slowly, like a man who had learned that sudden movements were misinterpreted here, and touched his right side, not the knee, higher, below the rib cage. She noted it. "How long?" He held up 4 fingers. 4 days. One blink. She documented it in the chart with the same steady handwriting she used for everything that mattered. She asked permission before she touched him. He gave it, one deliberate blink at a time. Blood pressure 162/97. Pulse 118, temperature 100.4, oxygen saturation 94 on room air, dropping to 91 when she counted his respirations manually. 26 breaths per minute, too fast, shallow on the right side. She listened to his lungs after asking. Left side, clear right lower field, diminished, not absent, not yet. She stepped back and wrote on the legal pad, "Your lungs sound different on your right side. I am going to flag this for the doctor." Eli read it. Then, for the first time in 22 days, he reached for the marker. His handwriting was large and came out slow, like a hand that had not held a pen in a very long time. They said it was anxiety. Tatum wrote back, "Anxiety doesn't change breath sounds. I disagree with that chart note." He stared at what she had written. Something shifted in his face. Not quite relief, but what happens just before relief, when a person stops bracing for the moment they will have to explain themselves again, and realizes, for once, that they might not have to. He wrote, "They said a lot of things about me." Tatum kept her expression neutral. "I know what the chart says. I'm asking you directly." A long pause. He looked at the window, then back at the pad. He wrote, "How long have you been a nurse?" 11 days here, longer before that." "Before that what?" She tilted her head slightly. "You ask everyone for a resume?" The corner of his mouth shifted. Not a smile. The crack in a door that has been sealed a long time. He wrote, "No, just the ones who hold a legal pad like they've written field notes in the dark." Tatum did not let anything cross her face. She capped the marker and turned back to the whiteboard. She wrote, "No students without consent. No additional staff without consent. No touching without asking." Then she faced him again. "May I listen to your chest one more time?" He blinked once. She listened again. Right side, lower field, still diminished. Worse than 5 minutes ago, or she was paying closer attention. Either way, it was wrong. It was the kind of wrong that compound interested over hours. She left the room without running and went directly to the station. "I need Dr. Sire," she said. Rhonda looked up from her clipboard. What did he do? Nothing. His status changed. Pulse 118. Oxygen down to 91. Right lower breath sounds are diminished. He's been in right-sided pain for 4 days and nobody documented it because the chart says non-communicative. Rhonda's expression went flat. He doesn't report anything. He doesn't speak. He does when someone asks the right way. Kyle set his coffee down. Dr. Kathleen Sire arrived from the physician workroom with a tablet and a particular species of irritation that came from being interrupted by junior staff. She was polished in a way that required consistent effort, and she looked at Tatum the way certain people look at a door that has appeared in an unexpected wall. "What is the situation?" she said, not a question. Tatum gave it clearly. Pulse, oxygen saturation, diminished breath sounds, right lower field, right-sided pain, 4 days duration, previously undocumented. Dr. Sire glanced toward room 7. He's been flagged for somatic complaints related to his psychological profile. His oxygen saturation is 91. Anxiety can produce perceived. Diminished breath sounds on one side cannot be produced by anxiety. The hallway went quiet. Dr. Sire's chin lifted. "You have been on this floor for 11 days. "Yes, and his right lung has been getting worse for 4. Kyle whispered something to the nurse beside him. Tatum caught the word rookie. Dr. Sire's voice dropped to the measured register she used when she wanted to sound patient. "Nurse Rowe, you will document your observations. You will not escalate without my order. We will not alarm a psychologically fragile patient based on the clinical impressions of someone with less than 2 weeks on this ward." Tatum held her eyes. His oxygen dropped 2 points while I was in the room. Document it. I'd like imaging reviewed. I'd like you to follow your supervisor's direction. Dr. Sire handed her tablet to a passing tech and walked back toward the physician workroom. Tatum returned to room 7. Eli had been watching the door. He wrote before she could speak, "Bad news?" She wrote, "Your doctor and I see this differently. I am not finished." He held the pad for a moment, then he wrote carefully, "People stop arguing for me pretty fast." Tatum did not look up from the drainage log she had started. Then they weren't arguing the right point. She documented his oxygen at 91 and flagged it in red. She pressed the call light and told the aide who answered to bring a portable pulse oximeter from the crash cart to room 7 immediately. Then she sat back down across from Eli and set the legal pad between them. He studied her for a moment. Then he wrote, "You've done something before that wasn't nursing." Tatum kept her handwriting even. "I've done a version of it." "What version?" "The version where rank gets in the way of the outcome." He looked at that. Then his pale green eyes moved over her face slowly, the way someone reads a map when they've seen parts of it before in a different context. He wrote, "Stone Arch." Tatum's pen stopped. Nobody outside a classified operational file had any reason to know that name. Stone Arch was the decommissioned designation for a 2-year embedded medical support program. Ranger units and a small detachment of special operations combat medics. No public deployment orders. No official record attached to their names. 3 operations. One of them in a river valley in a country she was not technically permitted to have been in. The pulse oximeter on his finger read 89. She kept her voice level. "That's not a name I'm familiar with." He wrote one word back, "Liar." She wrote, "Patient." His mouth did what it had done once before. Almost a smile, not quite, the crack in that sealed door opening a millimeter further. He held up his left wrist. On the inside, faded but clean, a small tattoo, a geometric shape, a diamond nested inside a diamond. The kind of mark operators gave themselves in the years after missions that would never appear in any record they would be permitted to discuss. Tatum had the same mark under her watch. She did not show him, not yet. His oxygen dropped to 87, the monitor alarmed. She picked up the room phone and called Rapid Response herself. The announcement moved through the building. "Rapid Response, Room 7. Rapid Response, Room 7. Rhonda appeared in the doorway in under 30 seconds. "What did you do?" His saturation dropped to 87. "You did not have authorization." "I had a patient in acute distress." Dr. Sire arrived behind Rhonda. Behind her came Kyle, his phone lowered this time, his expression no longer performing confidence. The rapid response team came in fast, a respiratory therapist, a senior hospitalist, 2 floor nurses. The hospitalist, Dr. Anita Vare, compact and precise, reading glasses pushed into her hair, looked at the monitor and then at Tatum. "Give me the picture." Tatum gave it without pause. 39-year-old male, selective mutism, post-op right knee 6 weeks out, right-sided chest pain 4 days, diminished right lower breath sounds. Oxygen fell from 94 to 87 in 40 minutes. Fever 100.4, pulse 118. Dr. Sire said, "He's been flagged for anxiety-related." "Anxiety doesn't drop SATs by 7 points in 40 minutes, Dr. Vare said. She was already listening to his chest. Her face changed in the way faces change when a suspicion becomes confirmed. She looked at Rhonda. "Portable chest x-ray now." Dr. Sire straightened. "I am the attending on this patient." "Then attend," Dr. Vare said. No one in the room laughed. They had moved past the point where anything was funny. Eli's oxygen hit 84. Tatum moved to the head of the bed and positioned herself where he could see her face clearly. She did not touch him. She wrote on the legal pad in large letters, "Stay with me, eyes on me." He found her gaze. She wrote, "Slow breath, in through your nose." He tried, his right side barely rose. She wrote, "You have been in worse rooms than this one." Something in his face steadied. He held her gaze the way you hold a fixed point in a dark room. Not because the point will save you, but because letting go has consequences you understand too well. The X-ray tech arrived. Dr. Sire objected twice. Nobody adjusted course. The image loaded on the portable reader. Dr. Vare leaned in. "Right pneumothorax, moderate, needs decompression." Dr. Sire stared at the screen. Her hand did not move toward the instrument tray. Tatum watched and understood exactly what she was watching. The attending physician had just received the correct diagnosis, the one she had dismissed 4 days into its development, and she was trying to decide whether her pride could outpace the outcome. Eli's oxygen hit 80, the gray had started at the corners of his lips. Dr. Vare reached for the decompression kit and handed it across the bed. Dr. Sire took it. 30 seconds passed. She did not open it. Eli's hand moved to Tatum's wrist. He did not grip. He placed his hand there the way you set something fragile on a surface you hope will hold. His eyes asked one question without writing it. She wrote fast, "You consent to emergency needle decompression, yes or no?" He blinked once. Tatum looked at Dr. Vare. Dr. Vare looked at Dr. Sire. Dr. Sire still had not opened the kit. "Patient consented," Tatum said. "I have it documented." She opened the kit herself. "You are absolutely not authorized to," Dr. Sire started. Tatum had already found the second intercostal space. She had done this before in rooms with no power and no reader to confirm what she was feeling. Her thumbs found the midclavicular line. She adjusted slightly right. His scar tissue changed the landmarks just enough to matter. She had learned that adjustment the hard way, in a place no one would ever write her name in connection with. "If you touch him," Dr. Sire said, "I will end your career in this." The catheter went in. The hiss was immediate, loud enough that everyone heard it. Eli's chest expanded on the right side for the first time in days. The monitor climbed 80, then 84, then 89, then 93. Tatum secured the catheter and stepped back. Her hands did not shake. The room went silent. Dr. Vare looked at Dr. Sire, then at Tatum. "Good save, let's get the chest tube set up." Dr. Sire stared at the monitor, then at Tatum, then at Kyle's hand, which was empty where his phone had been earlier. She performed an invasive procedure without. "With documented patient consent," Dr. Vare said evenly, while the attending had the kit in her hands. She did not look at Dr. Sire when she said it. "That will be in my incident report." Rhonda's face had gone the color of old wax. Kyle's phone was in his pocket. Tatum had already seen enough to remember. Eli recovered the way the body recovers from things it was repeatedly told were only in its head, slowly, and with a particular kind of anger underneath the relief. He had a chest tube placed by the trauma team that evening. He had antibiotics for a 3-day infection that the fever and the dismissed vital signs had been trying to announce since Tuesday. He had a surgical consult for a secondary complication in the right knee that had been buried under 3 pages of behavioral documentation. And he had, for the first time in 22 days, someone who read what he wrote back to him. At 9 in the evening, when the floor had quieted to its nighttime hum of monitors and soft footsteps, Tatum sat in the chair beside his bed and worked through chart notes. Eli woke and watched her write for a while before she noticed. He picked up the legal pad. "How did you know Stone Arch?" She wrote back, "I didn't say I did. You stopped writing when I said it. That's a tell. Rangers notice tells. You're not just a nurse." Tatum set down her pen. She looked at the window. The dark Georgia night pressed flat against the glass. "I am exactly a nurse. What I was before is a different conversation." He wrote slower now, like each word was a decision made in real time. "I know. I'm trying to get those records declassified. That's why I'm here, not only for my knee." She turned. "What do you mean?" He wrote one careful line at a time, his handwriting deliberate and large. "I witnessed a contractor falsify an after-action report. 3 men died that night because the root intelligence was sold twice. I submitted a formal complaint through my chain of command 18 months ago. No response. My injury happened 4 months after I submitted it. The vehicle that hit us, the driver knew the route." The room was completely still outside the soft pulse of his monitor. "Someone in this facility was notified I was here," he wrote. "My sedation orders were changed 2 weeks ago without my attending's knowledge. I read my own chart. I filed an internal grievance. It disappeared." Tatum looked at him for a long time. Then she picked up the marker. "What was the name of the operation you want declassified?" He wrote one word. "Coldfield." She knew that name. She had been there. Not in any record that would ever confirm she had been there, but she had. The administrative review was scheduled for the following morning. Tatum walked into that conference room, expecting to be the smallest person in it. Morris Gant, the hospital administrator, sat at the head of the table. Dr. Sire sat to his right. Rhonda took the chair closest to the door, which is where people sit when they are not sure whose side they will need to leave from. Kyle Pender was not in the room. Tatum had heard from the overnight shift that he had been in Gant's office at 6 in the morning. That the recording on his phone showed Dr. Sire holding the decompression kit for 41 seconds, while Eli Brand's oxygen continued to fall. "Nurse Rowe," Gant said, "please sit." "I'll stand." Dr. Sire's jaw tightened. "We are reviewing an incident of unauthorized clinical intervention," Gant said. "We are reviewing a patient who is alive because someone intervened. You are not credentialed to perform needle decompression independently. I am credentialed to respond to acute respiratory failure with documented patient consent. You countermanded your attending physician. My attending physician was holding the kit." Silence settled over the room the way it settles when a sentence has done damage that can't be walked back. You seem calm, Gant said, for someone facing formal review. Tatum had been in rooms smaller than this one, with people whose authority was measured in things more immediate than institutional titles. This was just a conference room with bad carpet and framed mission statements that needed the frames, because living them had never become habit. Dr. Sire leaned forward. There's another matter. Sergeant Brand used a name for you last night. Staff on the evening shift reported it. Tatum waited. He called you Cricket. Gant looked between them. What does that mean? Ask him, Tatum said. We're asking you. It's a name. People have names. Dr. Sire's smile was careful and cold, and classified operations. Something changed in the room's temperature, small but enough. Tatum turned and looked at her directly. Be careful with that sentence. Or what? That depends on how many more patients you plan to dismiss while their lungs are collapsing. The door opened before anyone could answer. Dr. Vare stepped in. Behind her, a woman in Army service uniform, silver oak leaves on the collar, a face that had been built by more weather than most people encountered in a lifetime, stopped in the doorway. Lieutenant Colonel Beau Ashmore did not knock. She did not need to. She looked at the room once. Then she looked at Tatum the way people look at each other when they have been in the same dark places at different times, and they both know it. Cricket. Not a question. No one moved. Gant pushed back his chair. Colonel, this is a closed administrative. I know what it is. Ashmore set a folder on the table. I also know that you have a veteran in this facility who filed a formal federal whistleblower complaint 17 months ago regarding Operation Coldfield. That his sedation protocol was altered without attending physician authorization 14 days after his admission. That he has been documented as non-communicative and cognitively impaired for 22 days while presenting a progressive respiratory condition that a nurse on her 12th day here correctly identified. Dr. Sire had gone very still. Ashmore opened the folder and placed documents on the table one at a time. The contractor named in Sergeant Brand's complaint has a financial relationship with 2 physicians at this facility. One of those physicians issued the sedation modification. She looked at Dr. Sire. I expect you can finish the sentence from there. Rhonda covered her mouth with one hand. Gant looked at the documents, then at Dr. Sire, then at the documents again, the way people look at things they have decided they cannot afford to understand. Dr. Vare said quietly to the room, I flagged the sedation order last week and escalated it internally. The escalation went to Dr. Sire's inbox. No one spoke for a long time after that. Tatum went back to room 7 when the meeting adjourned. Eli was awake. He had the legal pad ready, which meant he had been thinking about what he wanted to say. She wrote first. You're being transferred to a federal medical facility. Investigators are moving on your complaint tonight. The sedation order has been flagged and documented. He read it, then he wrote because of yesterday. Because you didn't stop writing. He looked at that line. Then he wrote slowly in the large, careful letters that had become recognizable to her. I woke up in this place without my voice. I thought that would be the hardest part. It wasn't. The hardest part was everyone around me deciding what the silence meant, like they had the right to put words in the space where mine should have been. Tatum held the pad and read it twice. She thought about writing something quick and reassuring, the way people write quick and reassuring things when the true answer requires more than a moment of sitting with it. She did not write something quick. She wrote, being voiceless doesn't mean being empty, it just means you needed someone willing to read. Eli stared at that line for a long time. Then he set down the marker. He exhaled. All the way the kind of exhale that happens when a person puts down something heavy they have been pretending, for a very long time, was not heavy at all. The administrative review did not conclude in a single day. These things never do. But some things ended that week. Dr. Sire was placed on administrative leave pending federal review of the sedation modification. Kyle entered formal remediation. The contractor connected to Coldfield had federal investigators at their offices within 72 hours of Ashmore's visit. And in the meeting that mattered most, the one with Gant, Dr. Vare, Colonel Ashmore, and 2 federal patient advocates sitting at a table that felt more serious than any of them had walked into that morning, Tatum did not sit down, and she didn't accept the first thing offered to her. I think we owe you an apology, Ms. Rowe, Gant said. I want policy, Tatum said. Written, signed, and posted on this floor before I come in Monday morning. Gant blinked. She gave it to them one item at a time, and she waited after each one to make sure it was being written down. Every nonverbal veteran admitted to this floor receives a formal communication assessment within 48 hours. Not a behavioral label, not a notation in a chart that says refuses to cooperate. An assessment conducted by someone trained in alternative communication methods. No patient is charted non-compliant, without documentation of every communication approach that was attempted, and how the patient responded to each one. No sedation order is modified without a face-to-face attending authorization. Not a message, not an inbox approval, a face-to-face. No staff member records a patient or a colleague during a clinical emergency. And no patient in this facility is ever again handed to a new staff member as a prank. That last one she delivered while looking at the empty chair, where Rhonda would have been sitting, if Rhonda had been invited. Gant nodded slowly after each point. Dr. Vare wrote every word. Colonel Ashmore stood near the window with her arms at her sides and said nothing until Tatum finished. Then she looked at Tatum the way two people look at each other who have been in the same dark room at different times and survived it by different means, and they understand each other without needing to explain. "Is that all?" Gant asked. Tatum thought about it for a genuine moment. "Training," she said. "Mandatory, every staff member on this unit. Communication with veterans who have neurological or trauma-related speech conditions. Not a pamphlet handed out at a staff meeting, a course, with a completion requirement." "Approved," Dr. Vare said before Gant had time to weigh it. 3 weeks later, the Glenridge Veterans Medical Center looked exactly the same from the outside. Same flat Georgia sky, same parking lot, same smell of pine and old concrete. Inside, room 7 had a new whiteboard. The large kind, the full wall kind, with colored markers and a cup on the ledge and a laminated reference card listing 12 alternative communication methods sorted by the motor ability they required. Eli Brand was discharged on a Thursday morning, which is as ordinary a morning as any other. He walked out on his own, the right knee still slow and still working on it, but carrying him where he wanted to go. Colonel Ashmore was in the lobby. 2 federal investigators waited in a car at the curb. At the nurse's station, the same counter where Rhonda had handed Tatum a chart 11 days into her tenure and smiled her particular smile, Eli stopped. He picked up the legal pad that had migrated to the countertop over the past 3 weeks, as if it had always belonged there. He wrote something. Then he held it up so that everyone on the floor who was watching, and most of them were watching, could see it. "You decided I was nothing. You were wrong about that." "She didn't decide anything," she asked. "Asking is the whole job." He looked at Tatum. She was standing at the medication cart with a chart pressed to her chest, and her braid pulled tight, and her cerulean scrubs pressed clean. She looked exactly like what she was, a nurse on a hard floor in a Georgia city, who had spent 11 days being handed the worst rooms, and had walked into the one that mattered, and refused to walk back out the same way she came in. Eli held the legal pad out to her. She took it, she read it. She did not say anything, because there was nothing left to say that the room had not already heard. Eli Brand walked out of the Glenridge Veterans Medical Center on a Thursday morning in the flat Georgia summer, and the lobby door swung shut behind him, and the flag out front moved in a small wind that had come from nowhere, and went nowhere in particular. Tatum clipped her hospital badge straight against her scrubs. It said Tatum Rowe, RN. No rank, no call sign, no sealed record, no classified commendation, nothing that the badge was large enough to hold. That was enough. Because sometimes the quietest person in the room is quiet for reasons that took a decade and a half to earn. And sometimes the patient everyone has categorized and flagged and is dismissed is carrying the truth that the whole building has been built around burying. And sometimes the new nurse in the cerulean scrubs is not small because she is weak. She is small because she learned, a long time ago, in rooms much darker than this one, that power is not in the loudest voice. It is in whose hands you trust when you cannot speak for yourself. And sometimes, not always, but sometimes, the right pair of hands walks in on day 12 and refuses to leave until the work is done. That's what room 7 taught this floor. And that's what this floor never forgot.